I am Dr. Subhrajit Nag, practicing consultant physician in Kolkata, West Bengal. Today, I have come to talk to you about understanding chest discomfort, recognizing heart disease versus heartburn. So, what is chest pain? Chest pain can be very alarming and for a very good reason. It might signal something as serious as a heart attack or something less dangerous like a heartburn. Our objective today is to help you understand the difference between heart disease related chest pain or discomfort caused by heartburn or acidity as we commonly know it. So you can take the right action when you are having the real problem and can easily seek treatment. Firstly, what is heart disease? Heart disease is a heart pain or discomfort related to chest pain, usually arises due to reduced blood flow to the heart. Heart-related chest pain usually is very traumatizing. It feels very different from new normal heart pain. But what we are going to talk about today is basically how to distinguish between the two symptoms. Whereas heartburn is usually caused by acidity or hyperacidity or acid reflux, as we know, where stomach acids are hypersecreted and it causes pain due to gastrointestinal issues. And this pain is usually relieved by taking antacids or other medications, as we know. Heartburn or heart pain related to chest pain is usually due to blocked arteries or what we commonly known as heart attack, or it can be due to impending heart attack or acute coronary syndrome. It is also termed as angina, for which there are medications available. Other causes of sudden heart pain might be inflammation of the lining of the heart or pericarditis, which is a complicated issue which needs immediate treatment, or due to issues of the aorta, that is the blood vessels arising out of your heart. If there is an aneurysm or a dissection, then there can be problems like that. So how to differentiate? This is the main point of topic that we need to talk about. Heart pain is usually of a heavy constricting type. It feels like someone is constricting your heart from inside. There is severe pressure like discomfort, often radiates up to the jaw or the left part of your shoulder, neck, arms, or back. It is totally different from a normal burning sensation that is usually felt by hyperacidity. The duration it can last for several minutes may worsen on exertion or heavy exercises, and symptoms tend to improve with rest or lying down. Angina can be also a part of it, which is improved on rest and worsens on exercise. Associated symptoms with such heart pains that we can tend to see is shortness of breath, nausea, sweating, lightheadedness, a feeling of impending doom. Whereas heartburn symptoms are typically a burning sensation all over the chest, going up, often starting from behind the breastbone and moving upward. It can usually triggers on lying down immediately after eating or having a very highly spicy, rich type of meal. You can also be worsened if you have too much adiabatic drinks like sodas and all. Usually duration is of short-lived and can be easily relieved by taking antacids. There might be also associated symptoms with hyperacidity like bitter taste in your mouth, regurgitation of food or acids, eructation, that is air coming out, heaviness or discomfort feeling in and around the stomach. Whereas chest pain, which is of cardiac origin, usually is not relieved by taking antacids. Of course, what we have to keep in mind that whenever you have such problems, which are essentially red flags, any pain in and around the heart area or cardiac area, it would be a red flag sign, and when you should really seek medical attention. If you're having the pain and you take some antacids, the pain is not relieved or does not decrease in intensity, chest discomfort is extremely severe, associated with breathing difficulty, episodes of fainting or losing consciousness, falling down, having extreme weakness, the pain radiating to the jaw or the arms or back. There is excessive sweating associated with it or nausea, along with feeling of palpitation and impending doom. It is always better to immediately seek emergency help. Remember, acidity is not life-threatening, whereas cardiac problems or cardiac pain or pain associated due to cardiac diseases is a life-threatening situation, and it is an important emergency whereby immediate treatment can easily control the problem But if it is delayed, the problem tends to linger and become life-threatening. So remember, it is always better to err on the side of caution. Assume chest pain is cardiac until proven otherwise. So now that we have come to talk about what we can specifically expect from your chest pain and hyperacidity symptoms, how to go about it, differentiate it, or when to seek treatment, we must now come to what we can essentially do as a preventive method or lifestyle changes that we can do to control heart-related diseases as well as also hyperacidity or heartburn. It is very commonly known that heart disease is usually developed more so in smokers. So smoking is the #1 leading cause of heart-related diseases. Along with that, in Southeast Asia, we have a high-fat, high-salt intake diet. So healthy diet along with cessation of smoking with regular exercise and managing of stress are important factors for controlling your heart disease. Monitoring and controlling risk factors like high blood pressure, high blood cholesterol, diabetes. If you have family history of heart disease, then having a regular checkup with your local physician, getting annual blood works done after the age of 40, these are very important factors. Along with this, keeping a healthy diet, having low extra salt in your diet, exercising regularly for 15 to 20 minutes, at least 5 days a week, having alcohol in limited quantities, managing your stress, maintaining a good work-life balance is very important. Whereas for heartburn or acidity, it is very simple. You must have smaller meals. Do not tend to lie down immediately after having your food. At least walk around for an hour or so and then go for lying down. Limit triggering foods which tend to go for your hyperacidity or heartburn. Such foods are usually trigger foods like spicy and fatty acidic foods, excessive soda drinking. Alcohol is also a very important reason. Also, along with this, maintain a very healthy weight, avoid excessive caffeine, stress, and excessive alcohol. This can very easily help you out in controlling your problem. So in conclusion, what we can say is that chest discomfort can be a very confusing symptom, but understanding the differences between heart disease and heartburn can really save lives. So it is always better to err on the side of caution. Always prioritize your health. When in doubt, seek medical attention immediately. Delay can be life-threatening. Also, if you can practice some of the healthy methods that we talked about, you can very easily avoid such problems and lead a healthy, happy life. So the most important takeaway that we can take from our talk today is this, that having a healthy lifestyle, avoiding smoking, avoiding alcohol, exercising regularly, having a good diet is very important in keeping your heart healthy. And the associated symptoms with hyperacidity or heartburn, which can be very easily controlled by a few ways that we have already talked about. But the bottom line is, whenever in doubt, it is better to seek help, because chest complications or heart complications are something which should be treated as soon as possible. So it is always better to err on the side of caution and seek medical help when you need. Thank you for your attention. I'm happy to take any questions you have.